There is a forbidden food sitting in almost every American kitchen tonight. And the cardiologists at Harvard have quietly confirmed it can destroy a 60-year-old heart in the middle of the night, while you're sound asleep, while you're dreaming, while no one in the house has any idea anything is wrong. Look, I need you to hear me clearly. The most dangerous heart attacks after 60 are not the ones you see in the movies. There's no chest clutch, no left arm going numb, no dramatic collapse at the dinner table. The ones that kill the most seniors in this country, they happen in absolute silence, between midnight and 6 in the morning, in a quiet bedroom, with a quiet body. And almost always, I mean almost always, they were triggered by something completely ordinary you did before you turned off the light. Hi, and before I say one more word, I want you to know exactly who is talking to you right now. I do not make videos based on opinions I pulled out of thin air. I do not chase trends. I do not repeat what some influencer said last week on TikTok. Every single video on this channel is built on hours of research, peer-reviewed cardiology journals, clinical trials from the Mayo Clinic, Johns Hopkins, Cleveland Clinic, Stanford, Harvard Medical School, and over 20 years of standing at operating tables holding human hearts in my own 2 hands. My promise to you is simple. I will only ever give you 100% honest, evidence-based opinions designed to do one thing: help you live longer, sharper, and stronger. I'm not here to scare you. I'm here to educate you so you can make better decisions starting tonight. That's the deal between us, and I take it seriously. So stay with me, because what I'm about to share is the same conversation I have with my own patients in the recovery room. The conversation most of them wish someone had with them 10 years earlier. Here's something most people don't know. Your cardiovascular system does not clock out when you fall asleep. It shifts gears. In a healthy body, nighttime is when your blood pressure is supposed to dip, usually 10 to 20% lower than during the day. Your heart rate slows down. Your arteries relax. It's a beautiful automatic maintenance cycle the body has been running for you your entire life. But after 60, that system becomes less reliable. The blood vessels stiffen. The pressure regulation gets sloppy. The hormonal signals that used to protect your heart at night, they start to fade. And the margin for error gets razor thin. Think about it like this. During the day, your heart has backup. It can compensate. It can adapt. At night, many of those backup systems are offline. Your cardiovascular system is running on a skeleton crew. That is what makes the night different after 60. That is why the hours between midnight and 6 a.m. carry the highest risk of heart attack and stroke for anyone in this age group. Not the afternoon, not the morning rush hour, the quiet hours, the hours when nobody is watching, but your habits are. And here's the part that should change how you think forever. What happens during those dangerous hours is largely determined by what you did in the 3 hours before bed. The meal you ate, the pill you took or didn't take, the temperature in your bedroom, the glass of water you skipped, decisions that felt completely routine, completely harmless. So let's talk about the first one, because this is the one that surprises my patients the most. Let me ask you something. What time did you eat dinner last night? And what was on the plate? I ask every single patient that question. And for a shocking number of Americans over 60, the answer is somewhere around 8, 9, even 10 at night. A full plate. Pasta, rice, fried chicken, maybe a piece of cheesecake, then straight to the couch, then straight to bed within an hour. Look, I get it. Busy lives, family schedules, the habit of a lifetime. But from a cardiac standpoint, this is one of the most underestimated, most damaging things you can do to your heart after 60. Here's what is happening inside your body when you eat that late dinner. Your digestive system demands an enormous surge in blood flow. Your heart has to pump harder to deliver it. Your blood pressure rises. And your triglycerides, those are the fats floating in your bloodstream, they spike sharply within 2 to 4 hours of eating. Now layer that on top of going to sleep. Your body was expecting the evening to be a wind down, a recovery phase. Instead, your heart is suddenly working overtime to digest a heavy meal and trying to shift into nighttime repair mode at the same time. Those two demands are in direct conflict. And in a person over 60, with even a little bit of arterial stiffness or plaque buildup, That conflict has real consequences. Now think about that on a cellular level for a moment. Inside your coronary arteries, there are these microscopic vulnerable plaques, little fatty deposits with thin caps over them. When triglycerides spike, when blood pressure surges, when inflammation rises after a heavy meal, those caps become unstable. One of them ruptures. A clot forms. And if it forms in the wrong place at 3 in the morning, that's the call I get at 4 a.m. Researchers at Harvard Medical School and the Cleveland Clinic have repeatedly shown that eating within 2 to 3 hours of bedtime is directly linked to elevated nighttime blood pressure, more acid reflux that can mimic and trigger cardiac symptoms, and a measurably higher rate of cardiovascular events during sleep. The fix? It is not complicated. Finish your main meal by 6 or 7 p.m. If you absolutely must eat later, keep it light. Lean protein, some vegetables, not heavy fats, not fried food, not a giant bowl of pasta. Does your dinner schedule look anything like what I just described? Be honest with yourself. You'd be amazed how many of my patients said yes and never once connected it to their heart. Now this next one, I need you to take very, very seriously, because this is where the most preventable damage happens in cardiology today. If you are over 60 and you take medication for high blood pressure, and statistically more than 60% of people in this age group do, the timing of when you swallow that pill matters enormously. More than most doctors take the time to explain in a 12-minute appointment. Here's the reality. For most people, blood pressure follows a predictable curve. It rises in the morning, peaks in the afternoon, and dips at night. But a huge portion of people over 60, particularly anyone with hypertension, do not get that nighttime dip. Their pressure stays elevated, or worse, it actually surges in the early morning hours. This condition has a name. It's called nocturnal hypertension. And most people listening right now have never heard those two words in their life. And it is dangerous in a way that daytime high blood pressure simply is not. Why? Because while you sleep, your arterial walls are not braced for impact. A pressure surge at 3 a.m. hits the artery walls completely differently than one at 3 p.m. It is far more likely to rupture a vulnerable plaque, far more likely to trigger clot formation, far more likely to send someone like you to a surgeon like me. If you take your blood pressure medication only first thing in the morning, it may be wearing off by the exact time you need it most. And if you forget it altogether, you may be leaving yourself completely unprotected during the most vulnerable 6 hours of your day. So what should you do? It's so simple it almost sounds silly. Talk to your doctor specifically about timing. Ask whether your medication should be taken at night instead of in the morning. The conversation takes 2 minutes. There is strong peer-reviewed evidence, including the famous Hygieia chronotherapy trial, that evening dosing of blood pressure medication significantly reduces cardiovascular risk during sleep. That is not a minor adjustment. That is potentially a life-saving conversation. Why hasn't your clinic told you this? I genuinely don't know, but I'm telling you. Don't assume timing doesn't matter. In cardiology, timing is the difference between life and death. Now, I want you to think about someone you know who snores. A spouse, a father, a friend, maybe you. That loud, irregular rumbling sound in the night. Most people treat it as a joke, something to elbow your partner about, something to laugh off at brunch. I treat it as a cardiac warning sign until proven otherwise. After 20 years in this field, I mean that literally. Sleep apnea is one of the most underdiagnosed, most dangerous conditions I see in patients over 60. The Mayo Clinic estimates more than 30% of older adults have some form of it, and the vast majority have never been diagnosed. They have absolutely no idea what is happening to their heart every single night. Here's what actually happens during an apnea episode. You stop breathing for 10 seconds, 30 seconds, sometimes longer. It can happen 30, 40, 50 times an hour. Each time the oxygen level in your blood drops sharply. Your brain registers this as a crisis. It dumps adrenaline and cortisol into your bloodstream. Your heart rate jolts up, your blood pressure spikes. Your heart wakes up while the rest of your body stays asleep. Now multiply that by 40 episodes a night, every night, for years on end. What that does to the cardiovascular system is not subtle, it's catastrophic. Sleep apnea is associated with a 3 times higher risk of heart attack. 3 times. That number alone should stop you cold. It's strongly linked to atrial fibrillation, which itself dramatically raises stroke risk. It accelerates the thickening of arterial walls. It silently fuels heart failure. And because the patient is asleep through every single episode, they have no idea until something serious happens. The warning signs are not always loud snoring. Watch for waking up with headaches, feeling exhausted even after 8 hours of sleep, frequent nighttime bathroom trips, dry mouth in the morning, or that horrible jolt of waking up gasping or choking. If any of those sound like you, please talk to your doctor about a sleep study. Here's what I tell my own patients directly. If you snore heavily, you're over 60, and you have any history of heart disease, diabetes, or stroke, getting evaluated for sleep apnea is not optional. It is part of your cardiac care, period. The treatment, usually a CPAP machine, is not glamorous. I know, I've heard every complaint. But the data on what it does for heart health is remarkable. Patients who actually use their CPAP show measurable drops in blood pressure, lower rates of atrial fibrillation, and significantly reduced cardiac risk. One device, one habit, massive protection. Now the next habit, this one is driven by something completely logical. And that is exactly what makes it so easy to overlook. Many of my patients over 60 deliberately stop drinking water in the evening. Why? Because they don't want to wake up at 2 a.m. to use the bathroom. Disrupted sleep is uncomfortable. Getting up at night raises fall risk. So they cut off fluids after 4 p.m. I understand the reasoning completely, but from a cardiovascular standpoint, going to bed even mildly dehydrated is a serious risk factor that almost nobody talks about. Here is what dehydration does at the cellular level. When your body is short on water, your blood becomes more viscous, thicker, stickier. The red blood cells clump together more easily. The platelets become more reactive. Your blood doesn't flow as smoothly through your vessels. For a 30-year-old, that's a manageable inconvenience. For a 65-year-old with arterial stiffness and plaque buildup, it is a completely different story. Thick blood, moving slowly through narrow arteries, in a body lying perfectly still for 8 hours. Add a slow nighttime heart rate on top of that, and that combination, dehydration, slow flow, narrowed vessels, is one of the biggest reasons strokes and heart attacks cluster between 4 and 6 in the morning. The fix is genuinely simple. Drink 1 8-ounce glass of water before bed. Not a gallon, just enough to keep your blood from thickening. Keep another glass on the nightstand. If you wake up thirsty at 2 a.m., that thirst is your body asking for something your heart also needs. You don't have to choose between sleep and cardiovascular protection. You can have both. Here is one that surprises almost every patient I mention it to, because it sounds way too simple to matter. What temperature is your bedroom right now? Most people have never once thought about bedroom temperature in terms of heart health. They think about comfort, about preference. But there is a specific temperature window that your cardiovascular system prefers. Step outside of it, and your heart works harder all night long. Too warm, above 72 degrees Fahrenheit, about 22 Celsius, and your body fights all night to dissipate heat. Vessels dilate, heart rate stays elevated, you sweat, you lose fluid, you drift back into the dehydration problem we just talked about. And critically, you spend less time in deep sleep, which is exactly when the heart does its overnight repair work. Now flip it. Too cold, below 65 degrees Fahrenheit, around 17 Celsius, and the opposite happens. The cold causes vasoconstriction. Your vessels squeeze tight to preserve core temperature. Blood pressure climbs. Your heart has to push against more resistance. For someone with coronary disease, that nighttime pressure increase is anything but trivial. The sweet spot, according to data from Stanford and Cleveland Clinic sleep research, is between 65 and 72 degrees Fahrenheit. That window keeps your body in thermoneutral territory. Vessels relaxed. Heart rate low and steady. Sleep deep. One thermostat setting. Real cardiovascular protection. Now look, everything I've described might sound like a long list of things to worry about. I want you to flip that around completely. Because when you put all 5 together, what you actually have is a blueprint. A simple, practical evening routine that protects your heart on all 5 fronts. I call it the heart-safe evening routine, and it fits into a normal life without any drama. Here's how it looks. Between 6 and 7 p.m., that is your dinner window. Lean protein, vegetables, moderate carbs if you need them. Not a feast, not a fast. Just a proper dinner at a civilized hour, giving your heart a full 3 to 4 hours to settle before sleep. By 7 p.m., water and medications. If your doctor has never specifically discussed the timing of your blood pressure pill with you, this is your reminder to bring it up. Between 8 and 9 p.m., your wind-down window. A gentle walk, a real book, a calm conversation with someone you love. Step away from the bright phone screen. That blue light is suppressing your melatonin and keeping your nervous system on high alert. By 9 p.m., check the bedroom. Set the thermostat between 65 and 72. Crack a window briefly for fresh air. Set a glass of water on the nightstand. 90 seconds of preparation. By 10 p.m., lights out. And one last detail that costs you nothing. If you snore, sleep on your side, not your back. Back sleeping dramatically worsens airway obstruction. A simple positional change can cut apnea episodes significantly while you wait for your sleep study. Dinner by 7, pills and water by 7, calm evening until 9, room prepped by 9, bed by 10, on your side. The data is crystal clear that this routine works. The only question is whether you'll actually do it. Now let me be honest with you for a moment, not as a content creator, but as a surgeon. I have stood at an operating table at 3 in the morning, holding a heart that stopped because of a clot that formed overnight in an artery nobody knew was vulnerable. I have walked into waiting rooms at dawn and looked into the eyes of families who had no idea anything was wrong when they kissed their husband or wife goodnight just 6 hours earlier. I have read autopsy reports on people who were planning their grandkid's birthday party the week before. And in case after case after case, the contributing factors were not mysterious. A late dinner, a skipped pill, a bedroom that was too warm, a body quietly running out of water, an airway that had been collapsing silently for 10 years, while everyone laughed off the snoring. These are not exotic risk factors. They are not rare. They are the background noise of millions of ordinary American evenings. And that background noise, accumulated night after night, year after year, becomes a cardiac event nobody saw coming. Because nobody knew to look. The hearts I've had to repair didn't fail because of bad luck. They failed because of bad information. Information the patients simply never had. You have it now. The only question is what you do with it. Tonight, not next week, not after your next physical. Tonight. Now I want to ask you something directly, and I genuinely want you to answer me in the comments below. Out of these 5 habits, the late dinner, the medication timing, the snoring, the dehydration, the bedroom temperature, which one hit closest to home? Which one made you sit up a little straighter? Drop a number 1, 2, 3, 4, or 5 in the comments. Or write a sentence telling me which habit you are going to fix starting tonight. I read these comments. I respond to as many as I can. And honestly, your answer might be exactly what someone else in this comment section needs to read to take this seriously. So please, take 30 seconds and tell me below. And if this video gave you something real, something useful, please share it. Send it to your spouse. Send it to your brother. Send it to that friend who snores like a freight train and still hasn't seen a doctor. There's someone in your life over 60 who has never once connected their bedtime habits to their heart. Be the person who finally tells them. If you're new to this channel, hit that subscribe button and ring the notification bell. Because every single week I bring you the same kind of evidence-based, no-nonsense information your doctor wishes they had time to explain. One last thing. Everything I've shared today is general medical information based on current cardiovascular research and my own clinical experience. It is not a substitute for your personal physician. Before you change your medication schedule, especially blood pressure timing, please talk to your own doctor. That's not a legal disclaimer. That is genuine advice from someone who wants you still watching this channel 10 years from now. Take care of that heart of yours. It has been working for you every single minute of every single night of your entire life. Give it the conditions it needs to keep going. Good night, sleep well, and I'll see you in the next video.